Welcome everyone. I'm Dr. Perkins, a board certified OBGYN, and I'm excited today to talk to you about, can pregnancy cause PCOS? So by the end of this video, you'll learn a little bit more about PCOS, what it is, how it may affect you. We'll review the impact of pregnancy on your hormones. We'll dive into, does pregnancy cause PCOS? And we'll end by talking about possible pregnancy complications that's caused by PCOS. So PCOS, believe it or not, is more common than you and I may think. And I actually think that PCOS is underdiagnosed in the United States. Not sure about the rest of the world, but definitely here in the United States. We, at this point, believe that PCOS occurs in 1 in 10 people. Clinically, I can tell you that from the patients that I see on a regular basis, maybe it's just where I am geographically, but it's more like 4 or 5 out of 10, so almost 50%. And you know, when we think about the issues that we have here in our country, where we are seeing more obesity and more overweight changes, when we look at the global picture here, we're seeing more and more and more PCOS. So what is PCOS? It is, by name, Polycystic Ovarian Syndrome. It is a hormonal disorder. It's a hormonal problem. It is a hormonal issue that affects the female reproductive tract. And so what I mean by that is that we have our ovaries. We have two. We have one on the right and one on the left. And the way that your ovaries function can be impacted by your hormones, which can be caused by PCOS. So let's talk about that a little bit more today. PCOS can look differently for a variety of people. And we know that it typically affects those who are in their reproductive years. So we're talking about those between puberty and menopause. PCOS can develop at any point in that time frame. And so we want to be aware of the symptoms as well as the causes and your risks. And so symptoms may look like you may have problems with hormonal acne, you may have difficulty losing weight, and it may be super easy for you to gain weight, especially abdominal weight. You may have issues with mood, where you may feel completely normal today and completely not normal the next day. You may have issues with hair growth on your face, very similar to that of a male, where you may have hair beneath your chin, even in your upper lip. You may have excessive hair on your arms, your chest, your thighs. And these are usually like not very fuzzy hair. This is like very coarse hair growth that can happen. These are just a small amount of the changes that can happen. I can probably list to you about 80 different symptoms altogether, but any combination of these symptoms can be linked with PCOS. And so getting tested is very important. The way that we diagnose this through testing is called the Rotterdam criteria. And so this is what a majority of providers or physicians may use to help to diagnose this issue. And so I'll tell you briefly what that may look like. The first is that you may have periods less than 9 times during the year. So you may skip a month or 2 in between a cycle. Your cycles are just not regular. Medically, we call that anovulation. It means that you're not ovulating on a regular basis. When you do ovulate regularly, your cycles are very predictable, where you can tell exactly when they're going to come. They come when they should, and you have at least 12 per year. And so anything under 9 for the year means that you are not ovulating regularly, and that is the first point that could be wrong with someone with PCOS. The second could be that you have an excessive amount of male hormones. Male hormones can be in the form of what is called androgens, such as testosterone. And there are several others as well that can be too high in a female. And so for us to know where you stand as far as these male hormones, you need a blood test to be done. This blood test can be done at any point during your period or your menstrual cycle and is quite accurate as far as how it looks. And so if you have elevated male hormones, that's another point that will give you the diagnosis of PCOS. The third is polycystic ovaries. And really this is a misnomer. This is not the correct term because PCOS as a condition that has polycystic ovaries, and that's not necessarily the case. If you do have a lot of cysts in your ovaries, that could be a part of the problem, but not everyone with PCOS has cysts or follicles in their ovaries that can be too many or poly. So how do you differentiate with these three things and determine who has PCOS? Well, the way that we do this is if you have two of these three things, you have PCOS. So you may have anovulation where you don't ovulate regularly, and you may have an excess in male hormones and you have PCOS, even though you do not have polycystic ovaries. Or you may have polycystic ovaries and have regular cycles, for instance, and you just don't have an elevation in male hormones, but you still have PCOS. And so any two of those three things will give you the diagnosis. It's important to understand this because for us to see cysts, we need an ultrasound. For us to know the male hormone levels, we need a blood test. And to know whether or not we have regular cycles, we need for you to track your cycles to know how many cycles you have per year. Once we have this picture together and we have a diagnosis, we can now do something about it. Now, when we think about pregnancy, we're thinking about hormones again, because we're hormonal beings and everything we undergo is somehow linked with hormones. It's very true. But pregnancy is really, truly one of those. And so during pregnancy, your hormones are going up and down dramatically. When we think of PCOS, and we think of pregnancy, oftentimes, if you have PCOS and you know you have PCOS and you achieve pregnancy, you can go through that pregnancy completely normally. If you do not have PCOS, you've been tested before pregnancy, your cycles were completely perfect, normal, and predictable, and you go through pregnancy and postpartum, you were diagnosed with PCOS. The question here is, did the pregnancy cause the PCOS? And the truth of the matter is, it could. PCOS can develop at any point in your life, closer to puberty or closer to menopause. And it definitely can develop after pregnancy because as your body goes through all of these hormonal changes with pregnancy, it could also lead to a permanent imbalance, especially when it comes to your ovulation and ovulatory changes because it never fully recovered from all the hormonal changes of pregnancy. And so yes, it can absolutely happen. Sometimes the way that you'll know that this has occurred is because you're trying for pregnancy again, for instance, and you're having a difficult time and you're not ovulating regularly and you're trying to figure out why. And so you go to your OBGYN and they do some testing and they said you have PCOS. And you're like, well, how? This is often the scenario and the time when you'll find out that you have PCOS. Now, if that happened to be your situation, it is okay. And you're able to control this condition. And I know that you're just like, well, it seems impossible, but there are ways to go about doing this. But before we even go into how to do that, I do want to also tell you that having PCOS does not mean that you are not fertile. It may mean that we need to create a specialized plan to help you get pregnant, but it does not mean that you cannot get pregnant. It also doesn't mean that you're going to have a problem during your pregnancy. People with PCOS can undergo normal pregnancies, deliver at term, they can have a vaginal delivery, they can have healthy babies and healthy pregnancies. I also want you to know that if you have PCOS and you're currently pregnant, that your postpartum journey may also be normal and without any additional complications. But I also want you to know that if you do have PCOS, there are certain things that we know can be a complication or a risk A small amount of people may experience these, but it does exist. I do want you to know that if you do have PCOS, it is possible that you may have an increased risk of gestational diabetes, gestational hypertension, preeclampsia, or even preterm birth. The likelihood of this happening is still quite low, but it is a possibility. And so if you do have PCOS, it's important that you have these conversations with your provider so that you can create a plan together that will help you through the journey. And so what else can you do? You're just like, well, we've talked with the doctors, we've had these conversations, we have a plan, but I really want to optimize how my body functions and the hormonal outlook of my system. What do? You want to start by making sure that your diet is appropriate. You want to make sure that you're eating enough fiber so you're eliminating excess hormones from your body. You want to make sure that you're moving in strength training, meaning lifting weights, resistance training. This is so important for helping to balance your hormones. It means that you want to sleep well at night. You're hydrating well. It means that your overall picture is creating balance for your system. And with PCOS, you can reverse all the symptoms of PCOS. And this can help you to achieve a normal pregnancy and postpartum course by just doing the things that will help your hormones become more balanced. And listen, if you need assistance with that, I am here to help you. I have a hugely discounted program called Madam Estrogen that you can find at the link below that I'm offering to you for listening in today. With this program, I'll provide you with accountability, workout plans, things to do to balance your hormones, and educate you on everything you need to know, from every food that you're eating to other endocrine disruptors and things that may be causing your body to be imbalanced. And so go ahead and click that link below and I'll send you some information. And if you have a comment, drop it below. And if you'd like to share this video with someone that may need to know some of these things, please help our community. Let's help each other be empowered to live our best lives. Thank you so much for listening in today. I'm Dr. Perkins. Take care.